you approach this very easy, right? So first, then you inspection did whenever, yeah. So what's it? Yeah. So even it is upper limb examination, you should like comment on his growth, any dysmorphic features, and you look, if it is neurological assessment, you look for any walking aid or any splints or something that, you know. So in exam, if you get upper limb examination or lower limb examination, most likely at your level, it can be a hemiplegic or a diplegic child, right? So most likely that if like they have a child with cerebellar symptoms, they have a child with cerebellar symptoms, they can give, right? So most likely it's upper motor neural lesion you will most likely get, or cerebellar signs. Sometimes if they had a patient with a wrist drop, they can give, right? But in medicine you can get those things, right? In the neurology ward you will find wrist drop everywhere, right? Right. And myotonia dystrophica that is less likely to be given to you, right? And if they had a Duchenne's muscular dystrophy child, that they can give, but they will give you lower limb examination, then, right? Less likely you can get upper limb examination, right? So anyhow, you go and inspect. If the child is like this, you go this side, look at the scap, whether there is prominent scapula, right? When they have Duchenne's muscular dystrophy, right? They can get weakening scapula. Get this proximal muscles are weak and atrophy. So look at his muscle bulk. It's good, right? And look at for any surgical scars, any biopsy scars from these muscle bulks. Cubital fossa, any tendon releasing mass, biceps balanna puluwan, right? So that they were lacking in your examination, right? So you should spend some time on that. Then the next thing you should ask is the child to put his like upper limb stretched. Baba mehem kara. Atla uda. Itara add karanna onne. Atla uda tiya. Then as wahagan. Right. So if the child is having a stroke, like this will go down, mehema rotate la ampalla, right? Which is called a supinated drift. That is if the child is having a cortical infarction, most likely acute, right? Right? They can keep. You should ask him to close the eyes. If they have a cerebellar problem, because when they have a cerebellar problem, their coordination is not there. But as long as they can see, they can maintain this position. But when you close the eye, they don't know whether they are maintained. So the cerebellum will try to correct it over and over. So most of the time, it goes like this, up. So if it is going up, that is cerebellar. If it is like pronation and then pronated drift, that is a stroke, cortical problem, right? So that you have to do definitely when it comes to upper, right? So in the child, it's not there. Then you go for the power. So always compare the actions, right? Make Isara, just make it was make Isara right? Then, and while when you ask the child to do like this, some children can do like this. Or they do like this. What is this? Bat-wing stem. Bat-wing stem occurs in Wilson's disease, right? That will, right? Then elbow මෙහෙම fix කරන්න අතට ඇතුළට එළියට and when it comes to then you can do like this මෙහෙම කියන්නේ හරි උඩ පුෂන් now you are checking what this action is from biceps this is tricep your flexion of the semi-pronated arm is from the brachioradius. Feel the bulk here and it's brachioradius. When it comes to S, itu mana kita? Udah tahu kan? Alright. Okay. I am not doing this because. Then when you are examining the fingers, you always use a support. Right? Use the pillow. Atau kan betul? අත උඩ තියන්න නේ මෙන්න මෙහෙම තියන්න right because if you do මෙහෙම කරාම his extension muscles will act against flexor muscles acting. So you need to neutralize the long muscles right so you keep like this huh අනිත් තරම් so I am doing only one hand now මේ මහපට ඇඟිල්ල උඩට සීලින් පැත්තට කරා ඇතුළට so always feel the bulk when you do it and always before doing this you examine the thenar eminence hypothenar eminence everything right make a diagram for the right then take the fingers you use a pen products Snellen chart එක තියෙනවා you can use this Snellen chart right so what this means මෙහෙම කරන්න කතා කරන්න මට අදින්න දෙන්න එපා so it's good so if they have a this what is this adductor brevis එක අවුලක් තියෙනවනම් they will do like this මේක අදින්න ගියා යාලා කොහොම කරන්නේ right so මේ muscle එක නෑ adductor muscle එක ගිහි right මෙහෙම කරාම they do like this then the rest of the fingers I will do one hand then you have to use same use your same finger web same finger web right you have to provide the same strength right so you have to do it with the other so you have to check for what is this polycystic flexor abductor then you have to check for adductors and then you have to check for introciliars lumbrics right that's enough right? So that is muscle strength then you go for what reflexes I forgot the tone yeah? So you can in upper limb you check the tone like this or you can do all at once I'm going to do that and then the other thing is you ask other click කරන්න other topic again later ගන්න in I told you a condition called grip myotonia so if you ask them to grip they can't grip right they will lose it that is myotonia right and or else if you ask them you ask to make a fist and release they have dystrophy myotonica when they make a fist then they are releasing it they have to release කරන්න පුළුවන් අපි අර release කරනවා they can't they will dystrophy myotonia right it's called grip myotonia or else you can do like this you can tap this muscle like this ඒතර එක අහුම් වෙලා ගම මෙතන ගහවම right Then you check for the reflexes. So reflexes are a portion it was difficult. So and you have to always observe this switch, right? මෙතන current එක වගේ යනවා පේනවා. දැන් මේ movement එක මේවා බලන්න. මෙතන jump challenge bulb මේක තමයි බලන්න. මේක බලන්න. ඒක මේක තමයි බලන්න. ඒක මෙහෙම grip කරලා මෙහෙම යන්න ගහන්න. මේ ඩොග් ගාලා මෙතන ගහුවට එන්නේ නැහැ. Then you have, if you want to do, you can do the sensor. Just like you get that kind of kick. Then you do the cerebellum, right? So you can either do this diadochokinesia and you can do the finger nostril, right? Yeah, if you have time, you can do both, right? This is easy, and you do this one. What else I missed? Usually, if you see only, you can. So in upper limb, you can check for clonus. There's no technique. Check clonus. Thank you.